High blood pressure, also known as hypertension, is called as the silent killer because it often goes unnoticed until it triggers several health complications. It is estimated that every 1 in 4 adults have hypertension, but only 12% of them have their blood pressure under control. Hi, I'm Dr. Lakshmi, and you're watching the Health Talk session by Yashoda Hospitals. So let's discuss about hypertension and its associated complications and ways to keep it under check. Joining our discussion today is Dr. T. Sashikanth, Senior Interventional Cardiologist from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Hi.
So high blood pressure is a condition that knows no boundaries, affecting people of different age groups. So to begin with, what exactly is high blood pressure or hypertension, doctor?
High blood pressure is defined as the systolic blood pressure is more than 140 millimeters of mercury, or the diastolic blood pressure is more than 90 millimeters of mercury. It does not mean that this is the sacrosanct number. It's been an arbitrary number wherein the blood pressure elevation beyond 115/75 has got a serial increased risk of cardiovascular events. That is to say that when the blood pressure is 115/75, the risk of cardiovascular events is very less. But when the blood pressure goes up to 130/80 or 140/90, there is a continual increased risk of cardiovascular events. That is to say that when the blood pressure is more than 140/90 millimeters of mercury, it is defined as hypertension for most of the age groups.
So according to a recent survey, it is estimated that every 1 in 4 adults have hypertension, but only 12% of them keep their blood pressure under control. So why do you think we Indians are more susceptible to hypertension, doctor?
It is not just Indians, but the entire world. There is a very high prevalence of hypertension. 1 in 3 or 1 in 4 individuals have high blood pressure. But what is important is most of the people are unaware of their high blood pressure. And that unawareness is making them lead on a normal lifestyle because it's a silent disease. It is not manifest most often with any major complaints, and the patient continues to live normally until an event happens which could be related to a heart disease, which could be related to a kidney disease, or it could be related to a brain disease. So it's a silent disease which continues to progress subclinically and does a lot of target organ damage to the brain, to the heart, to the kidney, and to the blood vessels. So even though the prevalence of hypertension is quite high in the world, about 30% of the population, urban and rural, have different areas of incidence of hypertension, nevertheless, a lot of unawareness is there for these patients with hypertension. And we need to make regular clinics, regular health checkups to understand which group of people are at higher risk of high blood pressure and which group of people need a immediate treatment.
So as you've rightly mentioned, that hypertension is referred as the silent killer because it often goes undiagnosed because it does not have any obvious symptoms. But do you think there are any subtle signs or symptoms that we should not neglect, doctor?
Most often, the person is not aware that he has high blood pressure. Sometimes there could be some symptoms which could throw a light or a suspicion that maybe the person is having high blood pressure, and that's how most of the people go and get the blood pressure checked up. Sometimes it's an opportunistic event that a friend or a neighbor has purchased a BP apparatus and you measure the blood pressure and you find that your blood pressure is high. Most often, the patients with high blood pressure, very high blood pressure, have headache, vertigo or giddiness. Sometimes they have a syncope, that is a transient blurring of vision. Sometimes they tend to fall. They could be having severe headache in the back of the head, or they could be having blurring of vision. A group of patients can present for the first time with a brain stroke, and that could be the first event that the patient who's had a hypertension for a long time. Patients can come with a heart attack. Patients can come with a very severe hypertension and heart failure. Patients can come with irregular heart beatings like atrial fibrillation, or they could be coming with a first time presentation of a kidney failure. So there could be a lot of complaints which are subtle, which are ignored by the general population, saying this is just an aging process, or he's tired because of his routine day-to-day activities or his stresses of life or multitasking. So one needs to be aware that this is a silent disease. We need to measure the number and then only know that the patient is having a high blood pressure. There is no other way, no symptom is specific or definite to say that this is responsible for the high blood pressure or hypertension.
So hypertension is a significant risk factor for many cardiovascular diseases. So what exactly happens if one does not get the right treatment at the right time for hypertension, doctor?
So any of these factors, the environmental factors, the lifestyle factors and the genetic factors put together with the complex autoregulation or cardiovascular regulation to the neurohormonal system, the humoral system, making high blood pressure a very complex subject. Multiple times it so happens that the patient ends up for the first time with a heart attack, with a brain stroke or a kidney failure, and that's the first time he is detected to have high blood pressure. So a lot of time has elapsed and a lot of organ damage has occurred because of high blood pressure. So it's very important, very pertinent that one measure the blood pressure and start treatment as early as possible to prevent the complications for target organ damage or organ damage in the form of a brain stroke, a heart attack or a kidney failure.
So once a diagnosis of high blood pressure or hypertension is made, doctor, what are the treatment options that are available for the patient?
So depending on the grading of hypertension and the stage of hypertension is presence or absence of an end organ damage. The target organ damage being brain, heart, kidney and the blood vessels. So when you have a target organ damage, it becomes very essential that you treat the patient very aggressively with optimal doses of drugs. But the bottom line, which is most often neglected by most of the general population, the patients themselves and even the clinicians, is that lifestyle management is very, very important. It has to be underlined. At every visit the patient makes to the clinic or to the outpatient department, it has to be underlined that lifestyle changes are very, very important. So lifestyle changes combined with drugs do give a major impact in lowering the blood pressure and thereby improving the quality of life and the quantity of life.
As you have correctly mentioned, that lifestyle modifications along with the right medications can prevent long-term complications associated with hypertension. So what are the long-term complications that are associated with this disease, doctor?
Now when the heart is contracting with a lot of resistance because of the high systemic vascular resistance, there is a left ventricular hypertrophy. The heart muscle thickens and increases in size. Now that is a very major risk factor for future cardiovascular events. When you come to the vessel damage, high blood pressure leads to endothelial damage and that leads to stiffening of the arteries. Now this stiffening of the arteries further propels and takes it into a vicious cycle of further propagation of hypertension. Treating hypertension reduces the risk of heart failure by 50%. Treating hypertension reduces the risk of stroke by 30%. Treating hypertension reduces the risk of heart attacks or myocardial infarction by about 20%. Now having said this, the second most important target organ damage which can happen is to the brain in the form of small vessel ischemic changes and of course a stroke or an intracerebral hemorrhage. Silently, whenever this hypertension continues to progress or it is not under control, there is a renal damage, a kidney damage continues.
Although hypertension is a common condition, it is often surrounded by many myths. Taking the first one, high blood pressure is a genetic condition and it cannot be prevented.
Blood pressure is has got a component of genetic factor, but not solely genetic. But like I said, environmental factors, like today we have a high degree of air pollution, a high degree of noise pollution, of course, extremes of temperature like extremely cold weather, extremely hot weather could be one of the important factors. Lifestyle factors like diet, alcohol, physical activity, stress, inadequate sleep, multiple of these factors, the environmental factors, could be having a major impact. So genetics do play a role, but not the sole factor.
The next one, high blood pressure is only seen in elderly age group population.
Hypertension incidence increases with age. Nevertheless, you could be seeing high blood pressure in an 18-year-old, in a 12-year-old, in a 25-year-old or a 40-year-old. So as the age advances, the incidence of prevalence of hypertension increases. It's an aging disease, an aging process wherein the arteries become stiffened and the blood pressure starts rising.
And taking the next one, once the blood pressure is under control, the medications for this can be stopped.
Yeah, that's a very, very important question what you have asked for. Now, once hypertension has been diagnosed, we make every effort to rule out white coat hypertension. Now, what is white coat hypertension? Is when the person visits the clinic, he is under tremendous stress, and that results in white coat hypertension. But for the same individual, when we record the blood pressure out of the clinic, the blood pressure would come as normal. If white coat hypertension is ruled out and the patient is having a grade 1 or grade 2 hypertension with a stage of organ damage, in that situation we need to treat. And once the treatment for hypertension is started, it is a lifelong treatment. There could be certain conditions wherein a pregnancy related hypertension could be a transient phase, wherein during pregnancy the person has hypertension, and once the pregnancy is over, delivery is over, the blood pressure becomes normal and continues to be normal. That is a phase wherein treatment is transient for a short period of time. But otherwise, if hypertension is diagnosed, the treatment is lifelong.
So early detection to control hypertension is one of the crucial factors to lead a healthy lifestyle. So what are the lifestyle modifications that you would encourage to pick up, doctor?
As a rule, probably the entire population should lower their salt intake. And so the sodium intake is normally said to be 2 grams, which is equal to about 1 teaspoon of salt, which is 5 grams of salt. The table salt, what we see in your day-to-day usage in the cooking. So we definitely say sodium restriction is a very important thing. It has to be underlined at every visit again. Having said about sodium, the second important step is to supplement potassium in the diet. Probably one needs to supplement potassium through the natural ways by increasing the fruit, 4 to 5 servings of fruit, vegetables, nuts, which is a very healthy contribution to the diet rather than taking potassium supplements per se. Alcohol is one very, very major risk factor for high blood pressure. Most often on Saturday and Sundays we have a weekend higher consumption of alcohol, and Monday we have a higher visits to the clinic with high blood pressure. Alcohol is one very important reversible risk factor for high blood pressure. Consumption of a DASH diet or a Mediterranean diet which is balanced with a vegetarian diet, low red meat consumption, low saturated fat consumption, increasing fruits and vegetables in the diet would make a lot of impact on hypertension control. A regular physical activity to the tune of about 150 minutes per week of moderate intensity physical activity, or even 70 minutes of intense physical activity per week would make a major impact in lowering the blood pressure. So each of these lower the blood pressure to some extent. So lifestyle intervention, lifestyle changes are very important. A last important thing is adequate sleep. Adequate quantity of sleep, the number of hours you sleep, and the quality of sleep is equally important. If the sleep is disturbed, the blood pressure rises the next day morning. And if this is a chronic situation wherein the person is on night duty for months on, weeks on, when he's on night duty, night shifts, in the present IT industry, this is what happens to keep the shifts system working, especially when they have clients in US. They keep awake the entire night. And most of these persons come with a high blood pressure because their quantity of sleep, the quality of sleep is very poor. So a good quality sleep is very, very important to lower the blood pressure. So if you obtain this lifestyle changes, in addition to regular physical activity, lower the stress, practice yoga, meditation, it makes a laugh, probably. Laugh is again one very important thing. Laughter a day really lowers the blood pressure significantly.
So undoubtedly, diet and fitness play a significant role to prevent or maintain high blood pressure, and there is a significant literature on this as well. So before we end this episode, doctor, what message you would like to give to our audience out there as far as high blood pressure or hypertension is concerned?
Know your numbers is a very, very important thing. You need to know your age. You all know that. You need to know your blood pressure. You need to measure it. There's no way of knowing it other than measuring the blood pressure. You need to know your weight. If you are on the higher side of body mass index, probably you need to lower your blood pressure, your weight. You need to measure your waist circumference. If your waist circumference is more than 90 or 95 centimeters, you have abdominal obesity and you stand a higher incidence of high blood pressure, diabetes, heart attacks, strokes, and multiple of other diseases. So one needs to know your numbers. Number two, if hypertension is diagnosed, it is a lifelong treatment. Do not discontinue the treatment at any stage unless your physician or doctor has advised you. Number three, lifestyle changes play a very important role, as important as medications in today's era. Number five, when we assess for hypertension, when we know for hypertension, we need to do a total cardiovascular risk assessment. It is just not lowering the blood pressure numbers. Lastly, very important, laugh a little, smile a little, relax a little, and your blood pressure would definitely lower.
So this brings us to the end of this episode. Remember that prevention of hypertension is within your control. Stay informed and make informed decisions and prioritize your health. We at Yashoda Hospitals are more than happy to answer your queries, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.